Assalamu alaikum. Today I will be teaching you the important topics for ENT, and I'll also be telling you about the topics individually so that you know that what things are important. So first of all, we'll start with the diseases of ear. You should know the basic anatomy of the ear. Then there are like different audiology texts, pure tone audiometry and tympanometry are important. Then for assessment, there are Weber's and Rene are quite important. Then there is vestibular system functions. In assessment, there are nystagmus and other vestibular functions. The balance, etc., are important. And then there are diseases of external ear, the otitis externa, and then there are important the middle ear. Um, uh, there is ASOM, CSOM, the processes, the surgical processes of laryngotomy, etc. And then there is cholesteatoma, tubotympanic and epicondylar type of ears are important. And then there is um, um, the complications are not very important. Then the autosclerosis is very important. Um, I'll teach you in a different video about it. And then the facial nerve palsy is important. Meniere's disease is important. The tumors are not very important except acoustic neuroma. And then there is a nose. You should know the basic anatomy. Nasal septum, deviated nasal septum is important. In external nose, there is important of rhinolith or foreign body. Okay, and then there are the rhinitis. Allergic rhinitis is important. Then there's nasal polypi, extremely important, and epistaxis is important as well as its management. Trauma to face is important. Um, okay, let's go to the oral cavity. These are the basic importance topic. I think you should study more, but if you want to study the basics, these are the most basic ones. Okay, in oral cavity, there you should know the anatomy. Okay, general anatomy, and then in pharynx, there is like anatomy is important, and the tumors are not very important. The adenoids are important. You should know what are adenoids and in which conditions they enlarge. And then there's acute and chronic pharyngitis, not very important topic, but you should study about it. The tonsillitis is important. You should know the instruments, Boyle Davis mouth gag and others as well. um, then there is larynx. You should know the anatomy of larynx. You should know about the inflammations of larynx, and um, in lesions, you should know about polypi of larynx and nodules of larynx. These are important. Cancer of larynx is important, and paralysis is important, but you should know how you should rehabilitate a person in case of laryngeal paralysis. Okay. Then there is tracheostomy, which is very important. You should know about what is tracheostomy and its different things. Um, in recent advances, there's like these chapters are not very important, and this chapter is important as well for your assessment of clinical. In operative surgeries, I should tell you about myringotomy is important, the grommet insection, etc. Then there's myringioplasty, tooth puncture, cardiac glue. You should know the instrument, lock. Sorry, cardiac lock. You should know what is septoplasty, um, a direct laryngoscopy. Okay, and tonsillectomy. You should know the procedure for adenine and SMR. Okay. Septoplasty is important, myringotomy and myringoplasty is important as well. So thank you very much. See you in the next video.